Your forecast first, sponsored by Matex Heating, Cooling, and Plumbing.
Well, it was a snowy morning for some out there across central Illinois. What we want to do is go and take a look at a time lapse here from our camera in Mattoon. Look at the snow and look at it melting away throughout the course of the day today. Yes, it was on all the cars there in the car dealership, you can see, and then there goes the snow melting away. They probably went out and cleaned off some of that there as well. But we did leave a little bit of a mess for that morning commute for many. But it's out of here. We're done with the snow. Not done with the cold yet, as temperatures are going to remain into the upper 20s through the rest of tonight. You can see Neal Street as people make their way home. Upper 20s, but there is some more rain in the forecast for the weekend. We'll show you when to expect that when we come back. WCIA 3 News starts right now.
Boxes of the COVID-19 vaccines have arrived, while the governor has bad news about the doses that are coming next. Also tonight, the vaccine means the beginning of the end of this pandemic. But should we be concerned about the side effects? And they lost their daughter to the virus. How this family is finding hope from the tragedy.
You're watching your local news leader. This is WCIA 3 News at 6.
This development will likely cut our state's projected Pfizer shipments this month by roughly half.
Illinois won't get nearly as much of the COVID-19 vaccine as we were promised this year. Good evening. I'm Jennifer Roscoe. Paul was on assignment. The first round of Pfizer's COVID vaccine arrived at several central Illinois hospitals today, but the second shipments expected later this month will be much smaller. Our Capitol Bureau Chief, Mark Maxwell, is live in Springfield with the latest. Mark, the Trump administration told states to lower their expectations.
Jennifer, it's the first bit of bad news in the rollout of the vaccine. Yesterday, it was elation for Governor Pritzker and top public health officials. Today, a bit of frustration, although they do expect that those vaccines will eventually arrive. It's unclear exactly what's causing this delay. The Trump administration offering no specific explanation, only telling states that the 17 million doses that they were promised over the next 2 weeks would be cut in half. The first round of vaccines are still arriving on schedule. Those first shipments arriving at Carle in Urbana, Memorial, and St. John's hospitals in Springfield as well today. But this round of only 109,000 doses statewide will only cover a fraction, about 14% of our healthcare workers. There's still a long way to go there, and the state's top public health official warning this setback could mean some of the most vulnerable people in our state have to wait even longer to get their first shot in the arm.
The only changes might occur if, with these decreased in allocations, it might slow the process for the skilled nursing facilities. As the, I guess, doses actually come in, that's when we can be guaranteed the actual numbers.
This is a massive logistical undertaking. Army General Gustav Perna overseeing Operation Warp Speed and all of these shipments, when and where they go out. The doses and those shipments planning to go out to several moving parts. Big cities and states getting their doses in separate batches. The second wave will be smaller, but it will also include shipments to pharmacies like CVS and Walgreens, who have partnered together with the federal government to help administer those shots to long-term care facilities. The shipments should arrive at the pharmacies next week. The shots should arrive in those patients' arms the week after. Jennifer?
All right, Mark. I'll be interested to know the reason behind why it got cut in half.
It could be a manufacturing and production stall. It could be that they want to hold back more for that second round of doses and delivery. We're waiting to find the details.
All right, let us know what you find out. Thank you so much. Now, as the first vaccine doses arrived at Memorial Health Systems, one doctor couldn't hide his excitement. Raj Govindaya called the day historic. Within Memorial, more than 10,000 employees need the vaccine. State guidelines say they will be the first to get a needle in the arm. Doses number in the hundreds this first week. COVID inpatient staffers are first priority. That includes pharmacists, respiratory therapists, and others.
And so this is really this is about the happiest I've been in 2020, and I'm looking forward to getting as many people vaccinated as possible.
The state will continue to distribute doses to regional sites. Officials there say they are encouraging staff to keep track of how they feel. And there is a lot of information out there about the side effects, and we wanted to clear up what is true and what is not when it comes to what you should expect if you get it. WCIA3's Courtney Bunting live in our newsroom now. So, Courtney, you talked to a pharmacist about this. What did he say?
Well, Jennifer, he explained there are some pretty common reactions people should expect or at least be ready for. For example, your skin may get irritated in the spot where you get that injection. You might also get a fever. This is all specific to the Pfizer vaccine. As far as fevers, as I mentioned, the studies showed some people getting around 102 and 104 degree temperatures. That's more likely after the second shot. If you remember, the Pfizer vaccine is 2 shots 21 days apart. Now, most of the time, though, reactions are pretty minor. Pharmacists with OSF say people should feel confident about getting the vaccine.
A lot of the other medications that we use that get approved, when they have studies of 8,000 people, 6,000 people, and they get approved for their use. This study in Pfizer alone had 44,000 people. So the amount of data that we have on the safety aspect is more than typical for the standard medication that would be prescribed by your doctor.
Now, those side effects typically last a couple hours to 2 days. This vaccine doesn't work, though, like a flu vaccine or other common ones. It's not an injection of a small amount of COVID-19. Instead, it makes our cells create a tiny bit of the coronavirus spike protein. Now, that basically causes your body to make antibodies against COVID-19. In other words, you can't get COVID-19 from this vaccine. Now, is there anyone, though, who shouldn't get the vaccine? Well, there are some who were not part of the studies. For example, people who are immunocompromised. However, Pfizer is planning to study them and their reaction to the vaccine at some point later. Live in the newsroom, Courtney Bunting, WCIA 3, your local news leader.
All right, Courtney, thank you so much. Now, the pharmacist that she talked to said he's aware of people having severe allergic reactions. They say they have a plan to observe patients for a half hour after getting the shot. They also have medications in the vaccination area to handle any allergic reactions. Now, the number of people in the ICU in central Illinois continues to be high. In Region 3, 82% are in the ICU. That's compared to 86% yesterday. Region 6 is at 71%. The state's 7-day positivity rate is still 10.3%. There are more than 7,100 new cases announced today, along with 146 deaths. And this is a follow-up. COVID-19 cases continue to climb at Danville Correctional Center. Illinois DOC reports 119 inmates have the virus. That's a jump from 97 earlier this week. A staff member has recovered. That drops the total to 38 staffers who have it. Today, the center kicked off a new testing initiative. Inmates and workers will be tested about every 3 days. It was a bounce-back night for the Illini, how the Golden Gophers paid for the bad play at the border battle, and also tonight.
Our goal with this project has been to assist COVID-positive patients and turn our tragic loss into something positive.
They lost her to the coronavirus, what they're doing to try and stop another death. And it was our first official snow of the season.
Yeah, how about that?
No, what was it?
16th.
16th.
Yeah, today was
a long time to wait.
Yeah, halfway through December, and we, finally get our first snow. So we'll see what happens here as we head throughout the rest of, well, what is going to be officially winter, but still a few days away. 31-27, highs, lows, averages, records. When we come back, we're going to talk about that snowy end, how there could be some more around into the weekend, and when those temperatures warm back up.